Imagine the intricate network of blood vessels in our brain, a delicate web supplying oxygen and nutrients vital for life. Now, picture one of these vessels rupturing, unleashing a torrent of blood that disrupts the brain's delicate balance. This, my friends, is the stark reality of a hemorrhagic stroke. Unlike its more common counterpart, ischemic stroke, where a clot chokes off blood supply, hemorrhagic stroke is a dramatic event, a sudden and often violent disruption of the brain's intricate machinery. We often envision strokes as something that happens to older adults, and while age is a factor, hemorrhagic strokes can strike anyone, regardless of age or health status. The impact of this bleeding within the brain is profound, leading to a cascade of problems from headaches and weakness to seizures and even coma. Understanding this often devastating condition, its causes, and the importance of immediate action is paramount in our journey towards prevention and recovery. Hemorrhagic stroke doesn't just happen. There are often underlying factors that weaken blood vessels, setting the stage for a rupture. One of the most common culprits is high blood pressure, a silent stalker that puts constant pressure on artery walls, increasing their susceptibility to bursting. Another contributor is an aneurysm, a weak spot in a blood vessel that balloons out, creating a ticking time bomb in the brain. These aneurysms can be present at birth or develop over time due to factors like smoking, high cholesterol, or even genetics. Beyond these, certain medical conditions like arteriovenous malformations, or AVMs, tangles of abnormal blood vessels, also increase the risk. AVMs, often present at birth, can rupture due to the pressure of abnormal blood flow. Understanding these underlying causes is crucial for identifying at-risk individuals and implementing preventative measures. Hemorrhagic strokes are like a thief in the night, often striking suddenly and without warning. However, there are often telltale signs, alarm bells our body sounds to warn us of the impending danger. One of the most common symptoms is a sudden, intense headache, often described as the worst headache of my life. Other red flags include weakness or numbness on one side of the body, difficulty speaking, blurred vision, and problems with balance or coordination. These symptoms arise from the disruption of blood flow and the resulting damage to brain cells responsible for these functions. Time is brain when it comes to stroke. Recognizing these symptoms and seeking immediate medical attention can make all the difference between life and death, or between a full recovery and long-term disability. Suspecting a hemorrhagic stroke is just the first step. Confirming the diagnosis and initiating timely treatment is crucial. Doctors employ various imaging techniques like CT scans and MRIs to visualize the bleeding within the brain and assess the extent of the damage. Once diagnosed, treatment focuses on controlling the bleeding, reducing pressure on the brain, and preventing further complications. Medications to lower blood pressure and stop seizures are often the first line of defense. In some cases, surgery may be necessary to repair damaged blood vessels, remove accumulated blood, or relieve pressure on the brain. The journey doesn't end there. Rehabilitation plays a vital role in recovery. Physical, occupational, and speech therapy can help regain lost function and adapt to life after a stroke. While the statistics surrounding hemorrhagic stroke can be daunting, it's important to remember that behind every number is a human story, a tale of resilience and the power of the human spirit. I've encountered countless individuals who, despite the odds, have navigated the long and arduous road to recovery, emerging stronger and more determined than ever. One such story is that of a young musician who, after suffering a hemorrhagic stroke, lost the ability to play his beloved guitar. With unwavering determination and the support of his loved ones, he relearned his craft, his music becoming a testament to his indomitable spirit. These stories serve as beacons of hope, reminding us that even in the darkest of times, the human capacity for healing and adaptation is truly remarkable. They underscore the importance of early intervention, comprehensive rehabilitation, and unwavering support in the journey towards recovery. While hemorrhagic stroke can be a devastating event, the good news is that many cases are preventable. By adopting a healthy lifestyle and managing underlying risk factors, we can significantly reduce our chances of falling victim to this silent threat. Controlling high blood pressure through diet, exercise, and medication is paramount. Equally important is quitting smoking, reducing alcohol consumption, and maintaining a healthy weight. Regular checkups, especially for those with a family history of stroke or other risk factors, can detect problems early on, when they are most treatable. Remember, knowledge is power. By understanding the causes, recognizing the symptoms, and taking proactive steps towards prevention, we can empower ourselves and our loved ones to live longer, healthier lives. Let's make a commitment to prioritize our brain health, for it is the very essence of who we are.